Cervical cancer is the fourth most common cancer worldwide in women. 660,000 women worldwide will be diagnosed with cancer this year of the cervix, and approximately 350,000 women will die from this disease. Today, I'm going to continue my series on cervical cancer. We're going to talk about the office colposcopy and cervical biopsy. That sounds good to you? Continue watching. Well, my name is duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about teaching women how to improve their lives and to have better health. Today, we're going to talk about a very common procedure that's done in the office. It's called an office colposcopy with biopsies. Now, when we think about cervical cancer and treatment and diagnosis, the best test we have is the Pap test. So the Pap test is a screening test for cancer of the cervix. Most women have had one. We start in the U.S. at the age of 21. From ages of 21 to 29, we do them every 3 years if they're normal and the patient's low risk. Usually after the age of 30, we'll do HPV testing with the Pap called co-test. You can also do HPV primary screening at age 25. Of course, the frequency of your Paps will depend on your personal history, and your doctor will tell you if you need to have more Paps more often than the standard Pap test guidelines. Well, the Pap test is a very easy test. We put some scrapings from your cervix in a medium called, this is a thin prep, and we send that to the lab. And when we get that back, typically it'll tell us if there's any abnormal changes. Sometimes it'll pick up infections. And when your provider talks to you about your results, they may say, oh, you need additional testing. Well, if you need additional testing, typically that means you might need a colposcopy of the cervix with biopsies. We also know that if you have human papillomavirus testing, and if that comes back abnormal, especially for one of the more aggressive strains like HPV 16 or HPV 18, your doctor may also recommend that you have a colposcopy biopsies. Now, the colposcope is just a big magnifying glass. It's a microscope that has a binocular lens, and it kind of looks like this. And what your provider will do will look through the magnifying glass at your cervix to see if there's any HPV-related changes that are concerning for cancer or precancer changes. Typically, you'll be in an exam room. You'll have your feet in stirrups. A speculum will be placed in the vagina to separate the vagina so that your cervix can be seen. Speculums look like this. They come in different sizes and shapes. They could be metal or plastic, but this allows us to be able to see inside the vagina to evaluate the cervix. Typically, your provider will also put some vinegar or acetic acid on your cervix, and typically we use these procto swabs, soak them in vinegar, and place them on your cervix. That may cause a little bit of stinging, but most patients tolerate it well. We do know that the abnormal cells will turn white, so that's what your doctor is looking for when they're doing the colposcopy. Now, we can also do a colposcopy of the vulva and also of the vagina. So let's say you had a hysterectomy and you don't have a cervix. You can still have a colposcopy because that's just a big magnifying glass, allows us to see up close of the vagina or the vaginal epithelium. And we also do the same thing for colposcopies of the vulva. If you have a lesion on the vulva or we're concerned about vulvar cancer, then you may have a colposcopy of the vulva or the outside of the vagina. Now, when we put acetic acid on the vulva, we have to leave it on a little bit longer because it takes a little bit more time to soak in. So typically I'll leave it on for a minimum of 5 minutes. So typically I'll place some gauze with the vinegar on the vulva and kind of walk out, let it soak, because if I sit there, I know I won't wait 5 minutes. And then I set my timer and come back, and then I'll do the colposcope of the vulva. So after the vinegar has been placed on the affected area, whether it's the vulva, cervix, or vagina, then your doctor will look through the colposcope to see if there's any abnormal changes. And someone who's very experienced at colposcopy will be able to detect different patterns on the cervix or vulva or vagina to be able to know what areas to biopsy. Once the area is biopsied, is sent to pathology, so we'll put it typically in some formalin or a fixative and send it to the pathologist. The pathologist will let us know if there's any concerning areas that your doctor needs to discuss with you. Procedure is very easy. It's very quick. I know over the years I'll have patients that'll get really nervous and be very anxious. We don't usually use anesthesia for this procedure because most patients do tolerate it very well. Sometimes if we're doing colpo on the vulva and we're taking a biopsy, we may numb that area because that's a little bit more painful. But typically biopsies of the cervix or vagina aren't as painful, so we don't typically use any local anesthetic. Once your procedure is done, your doctor will give you instructions. Typically, they may say pelvic rest, avoid any tampons or douching or intercourse for, a few days, and they will often see you back or give you a call with the result. Make sure you follow up, and if your doctor says, you need a PAP in 1 year, don't forget, put it in your calendar, make sure you come back in 1 year, because some things of the cervix grow very slowly, so we're looking at changes over time. And so make sure you follow up, because, over the years, I've had patients that I say come back in 1 year and then lost for a couple of years, and we don't want that to happen. So if there's something your doctor is monitoring, make sure you follow up. And then if you need additional testing, such as a bigger biopsy in the office or operating room, like a leak procedure or cold neck cone, your provider will talk to you about that. But the colposcopy of the cervix is very easy. It's a quick, safe procedure, very few complications. Your doctor may talk to you about the risk of bleeding. They may also put little medicine on your cervix to reduce the risk of bleeding. And typically that's it. It's very easy, it's safe. So don't be worried or overthink it or be scared. Your doctor will talk to you step by step on what they're doing so that you feel informed. Well, I hope that was helpful. If you have any questions or comments, please put them in the link below. And if you want more information on this topic, please watch this video next. Talk to you later. Bye-bye.